Friends, today we can discuss oncology nursing, some important questions for all government exams. Let us start. First question. Most common cancer in women of developing countries is options CA breast, CA cervix, CA uterus, CA colon. Correct answer is CA cervix. Most common cancer in women of developing countries is CA cervix. Signs and symptoms of CA cervix. Bleeding occurs between regular menstrual periods, bleeding after sexual intercourse or pelvic examination, menstrual bleeding lasts longer and heavier, increased vaginal discharge, pelvic pain. Signs and symptoms of CA cervix. Bleeding occurs between regular menstrual periods, bleeding after sexual intercourse or pelvic exam, menstrual bleeding lasts longer and heavier, increased vaginal discharge and pelvic pain. Second question. Most common germ cell tumor is options choriocarcinoma, teratoma, lymphoma, yolk sac tumor. Correct answer is choriocarcinoma. Most common germ cell tumor is choriocarcinoma. Choriocarcinoma is a malignant trophoblastic cancer, usually of the placenta. So, just note the point. Cancer of placenta, choriocarcinoma, is a malignant. Malignant means spread fast. Trophoblastic cancer, usually of the placenta. Chemotherapy is the treatment of choice for choriocarcinoma. Chemotherapy is the treatment of choice for choriocarcinoma. Methotrexate is the drug of choice. Methotrexate is a chemotherapeutic drug and methotrexate is the drug of choice. You may get questions: which chemotherapeutic agent is using to treat choriocarcinoma? That is methotrexate. This drug interferes the formation of nucleic acid and mitosis in the malignant cells and thereby arrest growth. So, the drug interferes the formation of nucleic acid and mitosis in the malignant cells and thereby arrest growth. Please note this carefully. Next question. Most common clinical feature of renal carcinoma. Options: pain abdomen, painless hematuria, fever and malaise, increased urination. Correct answer is painless hematuria. Most common clinical feature of renal carcinoma is painless hematuria. That means bleeding through urine. Renal carcinoma comprises about 3.5 to 4% of all cancers. Renal carcinoma comprises about 3.5 to 4% of all cancers. 30% of the patient with this cancer is metastatic disease to lungs, soft tissues, bone and liver. 30% of the renal carcinoma patient with this cancer is metastatic diseases, that means spreading to other organs, especially lungs, soft tissues, bone and liver. In this, lungs mostly spread to lungs. You may get some questions: in which area renal carcinoma metastasis fast? That means first it will spread to the lungs, then only soft tissues, bone and liver. Originate in renal cortex. CA kidney originates in renal cortex. Colorectal carcinoma is associated with options: high fiber intake, low fiber intake, low vitamin C intake, high protein intake. Correct answer is low fiber intake. Colorectal carcinoma is associated with low fiber intake. Colorectal cancer, also known as bowel cancer, colon cancer or rectal cancer. these three options means colorectal cancer is bowel cancer, colon cancer or rectal cancer is any cancer that affects the colon and rectum. Patients with Crohn's disease and ulcerative colitis, these two diseases affecting the gastrointestinal tract, patient may have a high form of diarrhea. These two diseases for long duration having high risk for developing colon cancer. Patient with Crohn's disease and ulcerative colitis for long duration having high risk of developing colon cancer. Next question. Oral cancer most commonly affects options: gums, tongue, lower lips, buccal mucosa. Correct answer is lower lips. Oral cancer most commonly affects lower lips. Cancer of oral cavity can develop any part of the mouth. Cancer of oral cavity can develop any part of the mouth. Risk factors of cancer oral cavity includes tobacco use, heavy alcohol use. Symptoms include sore throat that doesn't heal, lump or white or red patch inside the mouth. Symptoms include sore throat that doesn't heal, lump or white or red patch inside the mouth. Next question. Malignant tumor of bone is known as options: osteoma, osteogenic carcinoma, neoplasia, lipoma. Correct answer is osteogenic carcinoma. Malignant tumor of bone is known as osteogenic carcinoma. An osteoma is a new piece of bone usually growing on another piece of bone, typically skull. It's a benign tumor. An osteoma is a new piece of bone usually growing on another piece of bone, typically skull. It's a benign tumor. Benign tumor means it's not malignant type of tumor. It's not cause serious problem to the patient. Neoplasia is a new uncontrolled growth of cells not under physiological control. Neoplasia meaning is a new uncontrolled growth of cells not under physiological control. Lipoma, a lump under the skin that occurs due to an overgrowth of fat cells. Lipoma is a lump under the skin that occurs due to an overgrowth of fat cells. Next question. Which is not an oncological emergency? Options: hypercalcemia, hypocalcemia, sepsis, disseminated intravascular coagulation. Please carefully note the question. Not an oncological emergency. Hypocalcemia is not an oncological emergency. Which is not an oncological emergency? Hypocalcemia. Oncological emergency is a clinical condition characterized by structural or metabolic change caused by cancer or its treatment that requires immediate medical intervention. Oncological emergency is a clinical condition characterized by structural or metabolic change caused by cancer or its treatment that requires immediate medical intervention. Two oncological emergencies are hypercalcemia of malignancy and tumor lysis syndrome. Two oncological emergencies are hypercalcemia of malignancy and tumor lysis syndrome. Hypercalcemia experienced by 20% to 30% of cancer patients often during the course of disease. Hypercalcemia experienced by 20 to 30% of cancer patients often during the course of disease. It is more common in patients with the tumors associated with bone metastasis such as breast and lung cancer, multiple myeloma. Hypercalcemia is more common in patients with tumors associated with bone metastasis such as breast and lung cancer, multiple myeloma. So it is more common in bone metastasis. Which carcinoma is considered risky to metastasis into the brain? Options: cancer breast, cancer lung, cancer colon, leukemia. Correct answer is cancer lung. Which carcinoma is considered risky to metastasis into the brain? That is cancer lung. 5 major steps in metastasis. That is a process. The cancer cells are spreading to the other organs. So first step is invasion and infiltration of surrounding normal tissues. Then release of neoplastic cells, survival in the circulation, arrest in capillary beds of distant organs, penetration of lymphatic or blood vessels wall. So first step in invasion and infiltration of surrounding normal tissues, then release of neoplastic cells, then survival in the circulation, then arrest in capillary beds of distant organs, lastly penetration of lymphatic or blood vessel walls. Next question, Reed-Sternberg cells is a characteristic feature of options: Hodgkin's lymphoma, non-Hodgkin's lymphoma, leukemia, osteoma. Correct answer is Hodgkin's lymphoma. Reed-Sternberg cells is a characteristic feature of Hodgkin's lymphoma. Hodgkin's lymphoma, it is a types of lymphoma starts in white blood cells. Hodgkin's lymphoma is a type of lymphoma starts in white blood cells. It can develop in children or adults. It can develop in children or adults. Reed-Sternberg cells are large malignant lymphoid cells. Reed-Sternberg cells are large malignant lymphoid cells found in persons with Hodgkin's lymphoma. Reed-Sternberg cells found in person with Hodgkin's lymphoma. Next question, which of the following is an adverse reaction of vincristine? Options: nephrotoxicity, neurotoxicity, cardiotoxicity, lung infection. Correct answer is neurotoxicity. Neurotoxicity is an adverse reaction of vincristine. Indications of vincristine. Vincristine is a chemotherapeutic drugs. Chemotherapy medication used to treat a number of types of cancer. That cancers are solid tumors such as lymphoma, leukemia, multiple myeloma, retinoblastoma, etc. Chemotherapy medication vincristine used to treat types of cancers include solid tumors such as lymphoma, leukemia, multiple myeloma, retinoblastoma, etc. So friends, today's class is over. Thank you for watching. If you are not subscribed Nurse Queen channel, please consider subscribe now and please share this video to your friends. Thank you.